Well, I think prevention of SSI or surgical site infections is probably the major goal of any surgery department. Actually, it's a goal of any hospital care setting now, because today we're dealing with bugs that are much stronger, much more virulent, harder to treat. We're running out of antibiotic treatments to treat them. So it's even much more important today than it was, say, 10, 15 years ago. Prevention is where we have to start now, almost like we were before we had antibiotics. Recent data, and even data as much as 20 years ago, show that cold patients in the operating room are one of the precursors to developing SSIs. But not only that, but cold patients can also cause other system issues, cardiovascular issues also, to name another one. And so I think, but the primary one we want to focus on is surgical site infections at this point. The fact that your cold patients require much more oxygen. That oxygen, if they're cold, doesn't get to the wound healing site. And the studies now show that if the wound site remains cold, unoxygenated, then the healing process doesn't take place like it should. The patient's more predisposed to getting a surgical site infection. We have to look at the cost of treating, the effects of hypothermia. If certainly we get a systemic issue and we have to hospitalize them for say a vascular incident or some cardiovascular incident, or if they come back into the hospital for treatment for a surgical site infection, that cost is very high. I don't want to put a dollar amount to it, but it is, of course, it runs in the tens of thousands of dollars. There is a cost to maintaining a warm patient also. However, it's negligible, in my opinion, to the cost of having hypothermic patients come out of the OR. One of the initial costs, of course, is lengthy recovery room stays. Patients who are oxygen decompensated because they're cold, they'll shiver. They need, for instance, be treated probably with Demerol or something of that nature to help with shivers. There's the cost of the medication, the extended stays. Just the discomfort to the patient alone, I think, is a cost that maybe not have a dollar sign to it, but it certainly has a soft dollar sign down the road. But there is a tremendous savings in any type of prevention, and any type of retreatment for surgical site infections is very costly. There's definitely a cost to not doing it that far outweighs anything that the hospital may have to invest in equipment or supplies in order to help maintain the normal thermia of a patient in the OR. The OR is a very cold environment by its nature, and patients are paralyzed, they're asleep, they're in an undressed mode. They don't have any way to move around, keep themselves warm. So it's very easy to develop hypothermia if you're in the OR for over an hour. So pre-warming patients and warming them keeping them warm during surgery, warm fluids, warm infusion fluids, warm irrigation fluids, those type of things are very important, and I think are most effective actually in keeping the patient normothermic during an OR event.